Assalamu alaikum. In this video, I will try to explain in a simple way how to calculate the maximum number of cartridges in dental anesthesia. To make things easier, let's start by simplifying some numbers. The density of local anesthetic agents are almost similar to water, so we can say 1 milliliter of local anesthetic equals 1000 milligrams. Since the dental cartridge we use contains 1.8 milliliters, if the local anesthetic concentration is 100%, it would mean that the cartridge contains 1800 milligrams of local anesthetic. When the concentration is 1%, it means 18 milligrams per cartridge, and so on. 2% would be 36 milligrams, 3% would be 54 milligrams, and 4% would be 72 milligrams. The same method can be used to calculate the amount of vasoconstrictor in the cartridge. 1 over 100,000 dilution will give 0.018 milligrams. 1 over 200,000 dilution will give 0.009 milligrams. To calculate the safe dose for each patient, we need to remember the safe dose of each local anesthetic solution per kilogram, and the maximum recommended dose as well. We need to also remember that we are injecting another drug along with local anesthesia as a vasoconstrictor, which is usually epinephrine. The safe dose of epinephrine for healthy patients is 0.2 milligrams, where in cardiac patients it is 0.04 milligrams. First, let us calculate the maximum number of cartridges containing epinephrine 1 over 100,000 that can be given per visit for a healthy adult patient. We will divide 0.2, as this is a healthy patient, over 0.018 because we are using 1 over 100,000 epinephrine concentration. This would give us around 11 cartridges. However, in a cardiac patient, we will divide 0.04 over 0.018. This would give us around 2 cartridges. Notice the significant reduction. Now it's time for examples. A 22 years old, healthy, female patient weighing 40 kilograms. How do we calculate the maximum recommended dose for the local anesthesia xylocaine 2% with epinephrine 1 over 100,000? First, we need to calculate the safe dose of xylocaine for that particular patient, as the recommended dose are calculated based on the patient weight. We will multiply the 40 by 7, which is the safe dose per kilogram as we see in the table. 280 milligrams is the safe dose for that patient, but we need to convert that into carpules or cartridges, so we will divide 280 by 36 as we are using 2% concentration, which will give us around 7 cartridges. Let's take another example. This is a 30 years old, healthy, weighs 80 kilograms. What is the maximum recommended dose when using mepivacaine 4% plain without vasoconstrictor? We will follow the same method, multiplying the weight by the safe dose per kilogram, then dividing the total by 72 since the concentration is 4%. However, this calculation is wrong for one reason. We have to keep in mind not to exceed the maximum recommended dose, which is 400 for mepivacaine. So the safe dose will be around 5 cartridges. Another example, 50 years old, cardiac patient, weighs 50 kilograms. What is the maximum recommended dose when injecting xylocaine 2% with epinephrine 1 over 100,000? Xylocaine's safe dose is 350 milligrams for that patient. Dividing that over 36 will give 9.72 cartridges. Wrong! Again, that is wrong for one reason. Remember, we cannot exceed 2 cartridges for cardiac patients. One last example. 32 years old, healthy patient, weighs 120 kilograms. How will we calculate the maximum recommended dose for prilocaine 4% with epinephrine 1 over 100,000? As we do, 120 multiplied by 8, then dividing the 960 by 72, getting to 13 cartridges. However, that is also wrong. Can you find out why? Thank you for watching. I hope you find that useful. Feel free to give your feedback down here. Wishing you all the best. Yours, Ahmed Salim Assari.